Swadika and good afternoon. We are back with the English language summary of the press briefing live from the Center for COVID-19 Situation Administration, or the CCSA. Today is Friday, the 3rd of September, and I will be summarizing some important points that was just made by Dr. Apisamai Srirangsan, the Deputy Spokesperson for the CCSA. Now, allow me first of all to start with some reports about the update of number of vaccines that have been administered since the start of our national vaccine drive. So, as of yesterday, we administered a very good number of vaccines, and that's about 865,074 doses of vaccines, and so that brings us to a total right now of the accumulated number of vaccinations to over 34 million doses, and we are averaging every day now 650,000 doses or more per day. So that's very good news, and we hope that this trend continues as we keep on replenishing our supplies of vaccines. Also, the aggregate total of those who have received their first jabs of vaccines now stands at 21.7 million doses, while those who have received their second doses now stands at 7.8 million. So this number also includes the expatriate community in Thailand. As more and more people are being vaccinated, Dr. Apisamai just stressed right now that even though you've received both doses of vaccines or you've been fully vaccinated, it does not mean that these vaccinations will prevent the risk of transmissions of the disease, but vaccination will significantly reduce the risk of hospitalization and deaths. And so even if you've received your vaccines, we urge all of you to continue to stay vigilant and observe public health measures and exercise caution and also observe DMHTT measures as always. Now, while we're on the topic of vaccines, I have some good news to update you. And this is about the Moderna vaccine, as Thailand's government pharmaceutical organization, or the GPO, who is in the process of procuring Moderna vaccines, they recently reported that Zuellic Pharma Co., who's the authorized distributor of Moderna vaccines, has confirmed that the first consignments of vaccines will be shipped to Thailand during October through December, and this first lot will comprise of 1.9 million doses of vaccines. And afterwards, the delivery of an additional 3.1 million doses will be delivered to Thailand in the first quarter of next year. And therefore, this will complete the total purchase agreement of 5 million doses, so by the first quarter of next year. And of course, these were ordered by the issuance of private hospitals via the GPO. And this alternative vaccine supply was made available for purchase, will of course help reinforce the country's vaccine supplies, and I hope this will bring some peace of mind to those people who have booked their Moderna jabs with private hospitals and paid for them in advance already. So just to let you know that your vaccines are on the way. Also, we have a very happy update to bring to you. Today, the Japanese government also announced their confirmation to donate an extra 300,000 doses of AstraZeneca vaccine to Thailand. and we will share more information about the date of delivery of these much needed and valuable vaccines in due course. And the CCSA is greatly appreciative of the generosity of the Japanese government and their deed of friendship at a very important time for us. And also kudos to the Japanese government for doing their part and their contribution to securing vaccine equity worldwide. Now, allow me to report to you about the general situation of the statistics and the new confirmed cases. Today, we have new confirmed cases standing at 14,653. This is an overall trend and downward trend for over a week now. The WHO has also calculated that we are reaching about 11% of reduction on new confirmed cases. And also, this number of new confirmed cases is lower than the new number of recoveries. So, new number of recoveries today stands at 18,262. So, of course, the new confirmed cases we have reported separately from positive cases that have been confirmed by antigen test kits, as antigen test kits or ATKs are not entirely accurate, so we will only accept clinically confirmed or tested cases. New fatalities today stands at 271 cases. And again, the majority of the fatalities belong to those in risk groups, namely the elderly and those with 7 underlying medical conditions and pregnant women as well. And today, Dr. Apisamai stressed the importance of pregnant women getting vaccinated as soon as possible, as we've seen an upward trend and high risk of pregnant women becoming a new fatality. And overall, the total statistics of pregnant women who have unfortunately become fallen and succumbed to the disease now stands at 47. The total percentage of our fatality rate now stands at 0.99%. This is a high number. However, the WHO also predicts that very soon the number of deaths in Thailand will decrease. Now, the newly confirmed cases also has reported that Bangkok has had the highest infections today, standing at 3,428. Samut Prakan follows Bangkok with 1,237 cases, and Samut Sakhon with 859. Of course, the reports of infections continue to be high in the dark red zones, or the maximum and strictly controlled areas, and therefore it's important for people who are living in these areas to continue to practice universal prevention guidelines to reduce your risk of contracting the disease. Most importantly, since pregnant women are highly vulnerable and are at extremely high risk, we urge all of them to get vaccinated as soon as possible. Now I have some information to respond to some of the questions that have been raised by foreign residents regarding how they can obtain vaccine certificates as proof for use domestically in Thailand. So allow me to clarify. So foreign residents who have received their first dose of vaccines may now download the Thai Mall Prom application. This is a mobile application that also has English language. And this mobile application also supports both Android and iOS platforms. And you can download this application by using the 13-digit number, which can be secured in two cases. First of all, for those foreign nationals who happen to have the pink ID card, which is issued to you through the Labor Ministry, you can use that number to register with MAPROM. If you don't have that number, or if you've used your passport number to register for vaccinations with through other means, you can also find your 13-digit number on your appointment card. So on your appointment card, you should be given a 13-digit number that's located on the card. And if you can't locate this 13-digit number on your card, then please contact the venue or the place where you got your first vaccine, or the hospital that you got your first vaccine, and they should be able to help you with further information. Now I have more updates on the Phuket Sandbox scheme. Recently, Phuket province had found increasingly number of confirmed cases, and of course they have exceeded the benchmark of 90 cases that was set by the Public Health Ministry. And because of that, they have adopted a temporary travel ban into Phuket, and this is of course valid only for those traveling domestically into Phuket. And of course this travel ban was in place since the 3rd of August, and it's been extended continuously until today. However, we found that the public health authorities have been able to work very well and swiftly, and now Phuket will be ready to open for fully vaccinated domestic travelers to enter the province when it lifts the temporary travel entry ban on the 8th of September. So under these measures, domestic tourists will need proof of their hotel booking, which means that you have to have already paid your hotel booking or accommodation in advance. And if you wish to stay longer than 9 days, you must also get a COVID-19 test, a clinical test, which is an RT-PCR test. And of course, you will also have to bear the expenses for that test. So as of 8th of September, all visitors who have been fully vaccinated and have proof of vaccination can enter Phuket. And the vaccines that are recognized, of course, are Sinovac vaccine, Sinopharm, Sputnik V, and also a combination of Sinovac and AstraZeneca, and of course AstraZeneca, Pfizer, Moderna, or Johnson & Johnson. And of course you have to have had these shots, even your second shot of course, at least 14 days before entry into Phuket province, and also have a negative result of your COVID RT-PCR test, which has been issued 72 hours before arrival. Now moving along, I have some more good news and updates on some of the homegrown innovations and applications which will help reduce the risk of viral infections and assist our fight against COVID. So this is a new dentistry product to help protect dentists from contracting diseases. This has been developed by the Faculty of Dentistry of Mahidol University. So this is a new mouthwash which is made from Thai rice and it's very efficient in stopping the spread of pathogenic viruses, including COVID-19. So this product will be used before every dental treatment, and it's been found very effective upon laboratory tests on humans. All patients admitted to dental hospitals. So dentists from the Faculty of Dentistry said that it can inhibit the spread of COVID by 99.9%. So we're very happy that we have this new innovation in use right now, and the university will be using this also in field hospitals and correctional institutions, and of course also military camps during this COVID crisis. Lastly, I have another good new innovation which has been actually reported in the news media for some time now. It's Chulalongkorn University's new AutoVac robot, which is a very timely innovation because it can help draw COVID-19 vaccine doses more effectively. And this product was developed by the Biomedical Engineering Research Center of Chulalongkorn University, and it enables physicians to gain an extra 20% from each vaccine vial. So you can get up to 12 doses of AstraZeneca vaccine, and it can be drawn at a very fast pace, much faster than humans, so 4 minutes per vial. So the university will also be producing another 20 or 30 robots, which will be distributed for use and application to hospitals all over the country. So I'm very happy to have been giving you some good news for today, which is Friday before you relax for your weekend. And this is all the updates I have for you today. I hope you stay safe, stay healthy. Thank you very, very much for your kind attention, and have a pleasant weekend. And we'll see you again on Monday. ขอบคุณค่ะ สวัสดีค่ะ
ขอบคุณค่ะคุณ